The first call of the morning came before Avery Hale had even hung up her coat. She was still clipping her badge to her scrub top when the radio at the nurse's station crackled to life. A stroke alert, 4 minutes out. Elderly male, left side weakness, slurred speech. Charge nurse Dana Brooks didn't look up from her coffee. "New girl," she said. "Go stand by bay 6 and try not to get in the way." Avery didn't answer. She walked to bay 6, checked the suction line, checked the oxygen tubing, found the crash cart drawer someone had left unlatched, and closed it without a word. By the time the doors slammed open and the paramedics rolled in a man whose face had gone slack on one side, Avery already had gloves on. The resident on duty, a tall man named Owen Pierce, called out orders in the clipped rhythm of someone running on his 4th coffee. Avery moved before he finished the sentence, hanging the second IV bag, checking the man's grip strength, reading his pupils with a penlight she had pulled from her own pocket, rather than waste time hunting for the one bolted to the wall. "Who told her to do that?" Dana muttered to the tech beside her, a wiry young man named Marcus Lane. "Nobody," Marcus said. "She just did it." Pierce glanced at Avery once, the kind of glance that catches and holds for half a second longer than it should, then went back to barking for a CT slot. Nobody thanked her. Nobody had to. The patient was rolled out toward imaging within 9 minutes of arrival, and Avery was already stripping her gloves and washing her hands like nothing unusual had happened at all. Word came back 20 minutes later that the man had suffered a clot small enough to treat, the kind of stroke that leaves people walking and talking again within days, instead of leaving them changed forever. Nobody announced it to the department at large. It simply moved through the staff the way good news does in a place that sees so much of the other kind. A quiet ripple of relief passed from one set of scrubs to the next. That was the pattern of her first morning. Quiet, fast, correct. Nobody noticed correct. Correct didn't make noise. By 10 o'clock, the department had settled into its normal grinding hum, the sound of a hospital that never fully stops moving, just slows down enough to catch its breath. Avery restocked supplies in the closet nobody else wanted to touch, the one with the broken shelf and the missing label gun, and did it without complaint. She took the patient nobody wanted, an elderly woman with dementia who kept trying to pull her IV out, and sat with her longer than she had to, talking in a low, even voice, until the woman's hands stopped shaking. When the woman finally drifted into a calmer half-sleep, Avery checked the restraints on the bed rail one more time, smoothed the blanket over her thin shoulders, and noted in the chart that a sitter might be needed for the rest of the shift, a small kindness nobody had asked her to extend, and nobody would specifically thank her for. Dana watched all of this from the station and decided, somewhere around lunch, that the new nurse was either a saint or hiding something. She filed both possibilities under "not my problem" and went back to her charting. The jokes started small, the way jokes always start. A tech rolling his eyes when Avery double-checked a dosage that was already correct. A comment about how she walked like she was afraid of making noise. Someone left a sticky note on her locker that said "quiet, quiet, quiet," in handwriting nobody would ever admit to. Avery found it, read it once, and put it in her pocket instead of the trash. She didn't defend herself. She didn't ask who wrote it. She went back to work, and something about the calm with which she did, that made the joke feel smaller than it had been meant to be. At noon, a man named Calvin Ortiz came in with chest pain, and the department briefly held its breath the way it does whenever someone says chest pain out loud. Pierce ran the workup. Avery ran the leads, started the line, and was already reaching for the nitroglycerin before Pierce asked for it. He caught himself mid-sentence and looked at her. "You read minds now," he said. "I read monitors," Avery said. It was the most anyone had heard her say all day. Pierce laughed, short and surprised, and went back to work. Dana, 3 feet away, heard the exchange and felt something shift in her chest that she didn't have a name for yet. Not quite respect, not yet. Something closer to the itch of a question she hadn't decided whether to ask. Just after 1 o'clock, a man stormed up to the nurse's station, demanding to know why his father, brought in for stomach pain an hour earlier, hadn't been seen by a doctor yet. His voice climbed with every sentence, loud enough that patients in the waiting room turned to look. A younger nurse named Priya Nair tried to calm him and only made it worse, her own voice rising to match his, until the exchange had turned into something closer to a shouting match than a conversation. Avery stepped in without being asked, her voice dropping instead of rising, pitched low enough that the man had to quiet himself just to hear her. "Your father's pain level is being checked every 15 minutes, she said. "He's stable, and he's next in line for imaging. I understand the wait is hard. I would feel exactly the same way if it were my own father in that room." The man's shoulders came down an inch. He didn't apologize, but he stopped shouting, and that was enough. Avery walked him back to his father's bedside herself, checked the chart one more time, though there was no medical reason to, and left only once she was certain his anger had nowhere left to go. Priya watched the whole exchange from behind the station, arms crossed, something unreadable passing across her face. She didn't even raise her voice, she said to Marcus, almost as if calm itself were a kind of cheating. Marcus shrugged. Maybe that's the point. A little later, Avery caught something nobody else had noticed at all. She was passing Bay 2 when she glanced at a medication being prepared for an older patient with failing kidneys, a dosage that looked correct on paper but wasn't. Not for someone whose body could no longer clear the drug at a normal rate. She said nothing in front of the patient. She simply found the nurse preparing it, the same flustered Priya from the hallway, and asked quietly whether the kidney dosing chart had been checked. It hadn't. Priya's face went pale as she recalculated, catching the error with less than a minute to spare before the medication would have gone in. She looked at Avery, bracing for the moment to be reported, the kind of mistake that usually meant a conversation with a supervisor and a black mark against a young career. "It happens," Avery said simply. "You caught it before it mattered. That's the part that counts." She never mentioned it to Dana. She never brought it up again. Priya, however, found herself watching the quiet new nurse a little differently after that, the sharp edges of her earlier mockery dulling into something closer to gratitude she didn't quite know how to put into words. The afternoon brought a slow trickle of the ordinary sprained ankles, a child with a fever, a man who had cut his hand opening a can and insisted on telling the whole story twice. Avery worked through it all, with the same even pace, the same low voice, the same refusal to be rattled by anything that crossed the threshold. Marcus started timing her just to see. She moved faster than anyone he had clocked in 2 years, and she never once looked like she was hurrying. It was nearing the end of the shift when the first crack in her composure showed, and it showed for exactly 4 seconds. A teenage boy had come in after a fall from a skateboard, nothing serious, a dislocated shoulder that needed to be reduced. Pierce asked Avery to assist, to hold the boy steady while he worked the joint back into place. She stepped up, hands ready, voice calm as she talked the boy through, breathing slow. Then Pierce, mid-procedure, grabbed her wrist to reposition her grip. It was nothing. A reflexive correction, the kind doctors make 100 times a shift without thinking about it. But Avery's whole body went still, the stillness of someone who has just heard a sound they recognize from somewhere they don't talk about. Her jaw tightened. Her eyes, for one beat, were not in that room at all. Then it passed. She adjusted her grip, finished holding the boy steady, and the shoulder went back into place with a soft pop that made the boy yelp and then laugh with relief. Pierce never noticed anything had happened. Marcus, watching from across the bay, thought he had imagined it. Dana hadn't imagined it. She had been refilling a chart rack 2 feet away, and she had seen the exact moment Avery Hale left the room without moving an inch. She didn't say anything. She filed it away the same way she filed everything else about the new nurse, in a folder in the back of her mind labeled, "Don't know yet." The boy, oblivious to anything but his own relief, thanked Pierce twice, and never once thought to thank the quiet nurse, who had kept his arm steady through the worst of it. Avery didn't seem to expect otherwise. She cleaned up the bay, restocked the sling supplies for whoever needed them next, and moved on to her final chart of the day without a backward glance at the moment that had so briefly cracked her composure. Shift change came at 7, and Avery clocked out the same way she had clocked in, quietly, without ceremony. She walked to the locker room, peeled off her gloves and her badge, and noticed the sleeve of her scrub top had ridden up while she worked. A thin, pale line ran along the inside of her forearm, old and faded, the kind of mark that takes years to stop looking new. She tugged the sleeve back down before anyone could see it, though nobody was looking. Nobody ever really looked at her, not yet. Outside, the parking lot was nearly empty, the sky the flat gray of early evening in a season that couldn't decide if it was still winter. Avery sat in her car for a moment before starting the engine, hands resting on the wheel, eyes closed, breathing the way she had taught 100 other people to breathe in moments just like this one. Then she started the car and drove home, and nobody at Riverside General had any idea who she really was. On the drive, a news report on the radio mentioned unrest somewhere overseas, a place with a name she recognized instantly, even though the announcer pronounced it wrong. She reached over and changed the station without thinking about it, found a weather report instead, and let the calm, ordinary voice of the forecaster carry her the rest of the way home. Some sounds, she had learned, were not safe to sit with for very long. A weather report was always safe. Nothing in a weather report had ever asked her to decide who could be saved and who could not. They would find out. Not that week, and not the one after it. But the hospital had a way of testing people eventually, of throwing exactly the kind of night at someone that revealed what they were actually made of. Avery Hale had survived worse nights than any of them could imagine, in places far from clean hallways and vending machines and gentle jokes about being too quiet. For now, she was simply the new nurse, polite, careful, easy to overlook. That was about to change. A week passed before the hospital tested her again, and when it did, it tested her hard. It started as an ordinary Tuesday, the kind that lulls a department into thinking the universe has finally decided to behave. Avery worked her usual quiet circuit, checking vitals, restocking the closet nobody else bothered with, sitting with patients who had no one else in the room to sit with them. Dana watched her less suspiciously now, though she would never have admitted that the watching had changed at all. The jokes hadn't stopped completely. A nickname had started circulating, whispered more than said, the silent treatment, as if her calm voice were some kind of punishment she was inflicting on the rest of them, rather than simply the way she had always spoken. Avery heard it once, in the break room, two techs laughing about it over microwaved soup. She poured her coffee, said nothing, and left the room before they noticed she had been standing there at all. Around mid-morning, a woman in her 40s came in, convinced she was having a heart attack, hand pressed flat to her chest, breath coming in short, panicked bursts. A second-year resident named Holly Whitfield ordered the standard workup, an EKG and blood work, while the woman's husband paced the hallway outside, asking every passing staff member whether his wife was going to be all right. Avery sat with the woman while the results were pending, taking her pulse manually instead of relying only on the monitor, watching the rhythm of her breathing rather than the numbers on the screen. "Has anything been weighing on you lately?" Avery asked quietly. Before this started, the woman's eyes filled with tears almost immediately. Her mother had died 3 weeks earlier. She hadn't told anyone at work. She hadn't really told anyone at all. By the time the EKG came back clean, the woman's breathing had already slowed to something close to normal, steadied less by the equipment than by having finally said the thing out loud to someone willing to sit still and listen. Holly, reviewing the results at the station, glanced toward the bay with something like relief. "Panic attack," she said. "Good catch, getting her calm before I even had the labs back." She didn't need labs, Avery said. She needed somebody to ask the right question. Holly didn't have a response for that right away. She simply added a note to the chart, glanced once more toward the bay where Avery sat with the woman, and filed the moment away the same careful way Dana had been filing things for weeks, in a folder that kept growing heavier with every shift. It was just after 2 in the afternoon when a woman named Lily Turner was wheeled in by her husband, who had carried her into the waiting room himself because he didn't trust the ambulance to arrive fast enough. Lily was 26 years old, 6 months pregnant, and in the middle of a seizure that had already lasted longer than anyone in the room was comfortable with. The department moved the way departments move when the word seizure and the word pregnant appear in the same sentence, which is to say everyone moved at once, and none of it looked organized from the outside. Lily's husband stood pressed against the wall of the bay, both hands knotted in his own hair, repeating his wife's name in a voice that kept cracking lower with every repetition. A tech tried to guide him toward the waiting room, and he refused to move, refused to let her out of his sight, until Avery, without breaking the rhythm of what her hands were doing, spoke to him directly for the first time. "Stay right there," she told him. "Don't touch her, don't crowd the bed, but stay where she can hear your voice if she wakes up looking for you. That helps her more than the hallway will." He nodded, swallowed hard, and stood exactly where she had told him to stand, his panic finding somewhere useful to go instead of nowhere at all. Pierce called for diazepam. A second-year resident named Holly Whitfield, normally steady under pressure, fumbled with the IV line twice before getting it seated, her hands shaking with the particular fear of someone who knows there are 2 heartbeats in the room and only one chance to get this right. Avery was already at the bedside before anyone called her there. She turned Lily onto her side without being asked. protecting the airway, watching the rhythm of the seizure with an attention that looked less like nursing and more like counting down a clock only she could hear. 30 seconds, she said, voice low and even. If we hit 90, we need magnesium ready. Pierce glanced at her, surprised, because nobody had said the word eclampsia out loud yet, and she had already jumped 2 steps ahead of where the room was standing. You sure? He said, not a question really, more of a request for confirmation. Get it drawn up, Avery said. We'll need it whether I'm right or not. He didn't argue. Something about the flatness of her certainty made arguing feel like a waste of the only resource that mattered in that room, which was time. Holly drew up the magnesium with hands that had finally stopped shaking, steadied somehow by the calm radiating off the nurse beside her. The seizure broke at 78 seconds, just under the mark Avery had named. Lily's body went still, her breathing ragged but present, and the monitor beside her began ticking out a fetal heart rate that, after a long terrifying pause, settled into something close to normal. We need OB down here, Pierce said, already reaching for the phone. Already paged them, Avery said, 2 minutes ago. Nobody had seen her do it. She had stepped half a foot from the bed, made the call without raising her voice or breaking the rhythm of the care she was giving, and stepped back into position so smoothly that the whole room had simply absorbed the motion without registering it as separate from everything else happening. The obstetrics team arrived within 90 seconds of being paged, 2 nurses and an attending moving with the particular urgency reserved for 2 patients sharing one body. They took over with practiced efficiency, and Avery stepped back without ceremony, her job in that exact moment finished, ready to be needed somewhere else the instant somewhere else called for her. Lily Turner was stabilized and transferred up to labor and delivery 40 minutes later, both heartbeats steady, both prognoses, for the moment, good. Her husband gripped Avery's hand on the way out and tried to say something and couldn't get the words past the lump in his throat. Avery just nodded, the way she had nodded at 100 husbands and wives and parents before him, and let him go without needing the thanks finished. Dana had watched the entire thing from the doorway of the supply room, arms crossed, coffee long gone cold in her hand. She had seen nurses with 10 years of experience freeze in rooms like that one. She had seen residents who could recite the textbook chapter and verse fall apart the moment the chapter became a real person seizing on a gurney. She had never, not once in her career, seen someone count down a clock that precisely, like she had lived inside that exact countdown before, and knew exactly how long the body could be trusted to hold itself together. She found Avery afterward in the break room, alone, rinsing out a coffee mug at the sink. "Where did you train?" Dana asked. It wasn't friendly. It wasn't unfriendly either. It was the voice of someone who had finally decided the folder in the back of her mind needed at least one new fact in it. Avery didn't turn around right away. "Nursing school," she said, "same as everyone." "That's not what I asked." Avery set the mug down on the drying rack, dried her hands on a paper towel, and turned to face her. For a moment something passed behind her eyes, something old and tired and not unkind. The look of a person deciding how much of the truth a stranger has earned. "I worked somewhere else before this," she said. "Somewhere busier. Busier than here. Busier than here." Different kind of busy. Dana waited for more. More didn't come. Avery folded the paper towel, dropped it in the trash, and started toward the door. "One more question," Dana said, before she could leave. "That seizure. You called it down to the second. Magnesium before anyone said the word eclampsia. How?" Avery paused at the doorway, considering how much of an answer the question actually deserved. "Pattern recognition," she said finally. "You see something enough times, your body starts answering before your brain finishes asking the question. It's not magic, it's repetition. Repetition where? Somewhere that didn't give me the luxury of getting it wrong twice. It was the closest thing to an opening Dana had gotten in 2 weeks, and she knew better than to push through it too hard. She let the silence sit instead of filling it, and after a moment, Avery gave a small, tired nod, as if grateful the question hadn't been chased any further, and walked out of the break room with the same unhurried pace she walked everywhere, leaving Dana standing there with more questions than she'd started with. That night, after her shift ended, Avery sat in her car in the empty lot the way she had the week before, hands on the wheel, eyes closed. She thought about counting seconds in a different kind of room, with a different kind of light, where 90 seconds had once meant something closer to a death sentence than a seizure protocol. She opened her eyes before the memory could pull her any further down, started the engine, and drove home. The hospital kept testing her in smaller ways over the following days. A car accident victim with a head wound that needed careful monitoring, where Avery caught a subtle change in pupil response 20 minutes before anyone else would have. Each time the same pattern repeated itself: calm before chaos, certainty before confirmation, a stillness in her hands that never once translated into hesitation. The clearest example came 3 days later, when a boy named Owen Castillo, 7 years old, was carried into the department by his mother, his lips faintly blue, his small chest working hard for air that didn't seem to want to come. Asthma, the mother said, except it had never looked like this before. Never this bad, never this fast. Avery had the nebulizer mask out and running before the attending on duty had finished his exam, oxygen levels climbing on the monitor with every breath the boy managed to take in. She knelt at his eye level instead of standing over him, kept her voice light and unhurried even as her hands moved with total precision, turning the mask into something closer to a game than a piece of medical equipment. "You're doing great," she told him. "Breathe in through the mask like you're blowing out the biggest birthday candle in the world, except backwards." The boy, frightened and gasping, managed a small confused laugh around the mask, and something in his shoulders loosened just enough to let the medicine do its work faster. Within 10 minutes his color had returned, his oxygen levels climbing safely out of danger, his mother sagging against the wall in relief so total, it looked almost like collapse. Before they were discharged, Owen's mother caught Avery near the doorway, her voice unsteady, with the particular gratitude of someone who has just watched their child slip toward danger and come back from it. "I didn't know what to do," she admitted. "I just grabbed him and ran." "You did exactly the right thing," Avery told her. "You got him here. The rest was just a mask and a little bit of patience. Next time, if there is a next time, you'll know to come in sooner, and you won't be as scared. That's how this gets easier." The woman nodded, wiping her eyes, and Avery handed her a sheet of discharge instructions, along with a small card listing the warning signs that meant, "Come back immediately rather than wait and see." It was a habit nobody had taught her, a habit she had simply built over years of watching frightened parents leave with too little information and too much fear still riding in the car with them. "You're very good with him," the attending said afterward, signing off on the chart. "Children breathe better when they're not scared," Avery said. "Fear closes the airway faster than asthma does, half the time." It was a small thing, in the grand scheme of an emergency department's endless parade of small things, but it added one more entry to the quiet tally Marcus had started keeping in his head, the kind of tally you don't tell anyone about because saying it out loud would make it feel too much like gossip and not enough like respect. By the end of that week, the tally had grown long enough that he found himself watching her with something closer to admiration than curiosity. Dana, for her part, stopped making the small comments. She didn't apologize, because that wasn't who she was, but the assignments changed. Avery stopped getting the patient nobody wanted by default, and started getting the patient nobody else could handle, which was its own kind of acknowledgement, quieter, and more honest than any apology would have been. Even the sticky note ritual quietly died out. Nobody discussed it, nobody apologized for it, but the lockers stopped sprouting their small anonymous cruelties, and the break room conversations that had once turned to laughter at her expense turned, instead, towards simple curiosity, the kind that comes from genuinely wanting to understand someone rather than dismiss them. The mystery of her, though, only deepened. There was the scar on her forearm that she always kept covered. There was the way she sometimes scanned a room before entering it, eyes moving corner to corner in a pattern that had nothing to do with nursing and everything to do with something else entirely, something none of them had a name for yet. The clearest example happened on a quiet Wednesday afternoon, when a tech rounding a corner too fast knocked an entire tray of metal instruments off a cart. The crash echoed down the hallway, sharp and sudden, and for exactly 1 second, Avery's whole body went rigid where she stood, shoulders locked, eyes fixed on a point in the middle distance that had nothing to do with the hallway in front of her. Marcus, walking beside her, felt her arm brush his and go tense as a drawn wire. "Hey," he said quietly, "just a tray." The words seemed to reach her from somewhere far away. She blinked, and whatever had taken hold of her let go all at once, her shoulders dropping back into their normal, careful posture. She bent down without comment and helped gather the scattered instruments off the floor, sorting them back into their tray with steady, practiced hands, as if the previous second had never happened at all. You okay? Marcus asked, once the tray was back on the cart. Loud sounds, Avery said simply. Old habit. I'll outgrow it eventually. She said it lightly, almost like a joke, but Marcus noticed she didn't quite meet his eyes when she said it, and he found himself thinking about that moment for the rest of his shift, turning it over the way you turn over a stone you suspect has something living underneath it. Nobody asked. Not directly. The questions sat in the air of the department like static, present but untouched, the way people avoid stepping on a crack in the floor without quite admitting why. It was a Thursday night, 10 days after the seizure that had first cracked open Dana's certainty, when the dispatch radio crackled with a tone none of them had heard in months, the kind of tone that meant something had gone very wrong somewhere out on the highway, and the hospital was about to need every steady hand it had. Avery was restocking gauze in Bay 4 when she heard it. She set the box down without finishing, and for the first time since she had started at Riverside General, her face showed something that looked less like calm and more like recognition, as if some part of her had been waiting for exactly this kind of night to arrive. Multiple casualty incident, the dispatcher's voice said through the radio, flat and clipped. Charter bus versus guardrail. Interstate 40. Estimated 20-plus patients. Multiple critical. ETA first units. 6 minutes. The department went silent for one full second, the way rooms do right before they explode into motion. Then Dana's voice cut through it, sharp and loud. All hands. Now. Clear every bay we've got. Avery was already moving before the sentence finished. Somewhere underneath the calm, steady surface she had worn for 2 weeks straight, something else was rising to meet the night ahead, something the rest of them hadn't seen yet and weren't prepared for. They were about to. 6 minutes is not very long when 20 lives are riding toward you on stretchers, but it is an eternity when you are standing in an emergency department trying to turn empty bays into a battlefield hospital before the first ambulance even reaches the parking lot. Dana stood in the center of the department, calling out assignments in a voice that cracked once and then steadied. Pierce was on the phone with the trauma surgeon on call, a sharp-voiced woman named Grace Bennett who was already pulling on scrubs 3 floors up. Marcus and 2 other techs were wheeling extra gurneys out of storage, lining them along the hallway like a row of empty beds waiting for names nobody had yet. Phones rang at every station as off-duty staff were called in early, voices clipped and urgent. The particular controlled panic of professionals who have trained for exactly this moment and are now discovering whether the training actually holds. Somewhere down the hall, a janitor was clearing a path through the waiting room, moving chairs aside to make room for whatever the night was about to bring through the doors. Avery moved through the chaos with a different kind of motion than everyone around her, while the rest of the staff scrambled bay to bay, gathering supplies as they thought of needing them. Avery walked a single fast loop through the department, eyes scanning, and in less than 90 seconds had mentally sorted every available bay, every working monitor, every oxygen line that still had pressure behind it. Bay 1, 2, and 4 can take critical, she said to Dana, not waiting to be asked. 3's oxygen line is reading low. Don't use it for anything serious. 6 and 7 are clear for moderate injuries. Hallway gurneys for walking wounded only. Dana stared at her for half a second, the kind of half second where a decision gets made without either person announcing it. Do it, she said. You're running triage at the door. It was not a small thing to hand a 2-week-old nurse the position that usually went to whoever had the most years on the floor. Triage at the door meant deciding, patient by patient, who needed care first and who could wait, sorting human lives into categories with nothing but seconds and instinct to guide the choice. Dana had made that decision in the space of half a breath, and she would spend the rest of the night wondering what exactly had told her it was the right one. The first ambulance arrived 4 minutes later, lights washing red and white across the bay doors, and after that the night stopped being measured in minutes at all. It became measured in patience. The first stretcher held a teenage boy with a broken leg and a face full of fear. Conscious, talking, scared but stable. Avery glanced at him for 2 seconds and waved him toward Bay 6. The second stretcher held a woman in her 50s with a head wound that had soaked through the gauze the paramedics had wrapped around it, her eyes glassy, her words slurring in a way that had nothing to do with a normal head injury. Bay 1, Avery said. Tell Dr. Pierce possible bleed, altered mental status, GCS dropping. The paramedic, a broad-shouldered man named Noah Bishop who had clearly seen his share of bad nights, looked at her for a half-second longer than necessary, surprised by the precision of the call from someone he had never met before. Then he was moving, because there wasn't time to wonder about it. The stretchers kept coming. A man with a crushed hand, walking wounded, sent to 7. A child no older than 8, conscious but clutching her side, sent straight to 4, with a note that made Pierce's face go tight the moment he read it. An older man who wasn't breathing on his own anymore, sent to 1 with Bennett herself meeting the gurney at the door, scrubs barely tied, already calling for the operating room to be ready. Avery stood at the center of it, a small still point in a hallway full of motion, and somehow every decision she made in those frantic seconds landed correctly. She didn't second-guess herself. She didn't pause to explain her reasoning to anyone who asked, because there wasn't time for explanations, only for the next decision and the one after that. Dana found herself, in the strange, quiet moments between stretchers, simply watching her work. There was something about the way Avery moved that reminded her of nature documentaries she'd half-watched as a kid, the way certain animals could read an entire landscape in a single glance and know exactly where danger was coming from before it arrived. It wasn't training. Training made people fast and careful. This was something underneath training, older, the kind of instinct that only gets built by living through nights far worse than this one, over and over, until your body stops needing to think about it at all. The child Pierce had been sent toward Bay 4 turned out to be a girl named Hannah Webb, 9 years old, clutching her side and crying not from pain alone but from the particular terror of being separated from her parents in a room full of strangers. She had been traveling with her grandmother, who had been taken to a different bay entirely, and nobody had yet found a way to tell her that. Pierce worked quickly to assess the injury, a fractured rib that had thankfully not punctured anything vital, but the girl's crying had climbed into something close to hysteria, her small body rigid with fear that no amount of clinical reassurance seemed to touch. Avery crossed to the bay between 2 other tasks, knelt down so she was level with the girl's face, and spoke in a voice pitched soft enough to cut beneath the noise of the department around them. "My name is Avery," she said. "I know this is scary. I know you want your grandmother. I'm going to find out exactly where she is, and I'm going to come back and tell you myself. Can you hold on for me for 2 minutes?" Hannah, startled out of her panic by the directness of the question, managed a small nod. Avery kept her word. She found the grandmother 2 bays down, confirmed she was stable and conscious, and returned to Hannah within the 2 minutes she had promised, relaying the news in the same calm, steady voice. "She's okay," Avery told her. "Banged up, same as you, but okay. She's asking about you too." The girl's shoulders finally came down from around her ears, and Pierce was able to finish splinting the rib without a fight. It cost Avery less than 90 seconds out of a night where every second mattered, and it was the kind of 90 seconds nobody would ever write up in a report, the kind that never showed up in any tally of saves or outcomes, but it was the difference between a child who fought treatment out of fear and a child who let herself be helped. Somewhere around the 9th patient, the rhythm of the night nearly broke. A young man named Ethan Cole was wheeled in unconscious, his chest rising in shallow, uneven movements, blood pressure dropping on the monitor even as the paramedics tried to keep up a steady stream of fluids. He was 22 years old. He had been sitting near the back of the bus, the part that had taken the worst of the impact, and his body was telling everyone in the room that something inside him was bleeding faster than anyone could see. "Internal bleed," Avery said, the moment she laid eyes on him. "Possible splenic rupture. He needs surgery now, not in 20 minutes. Bennett, who had just finished with the first patient and was wiping her hands on a fresh pair of gloves, turned at the words. "Who said that?" "I did," Avery said. "Pressure's dropping too fast for anything else. Belly's rigid. He needs the OR." Bennett crossed the room in 4 steps, pressed 2 fingers to Ethan's abdomen, and felt the same rigidity Avery had clocked from 6 feet away. She didn't ask any more questions. She called for the OR to be cleared immediately, and Ethan Cole was wheeled out of the department less than 90 seconds later, Bennett jogging alongside the gurney, already calling out instructions to the team waiting upstairs. It would turn out, hours later, that Avery had been exactly right. A ruptured spleen, bleeding internally since the moment of impact. The kind of injury that kills quietly while everything on the surface still looks survivable. Ethan Cole made it through surgery because someone in that chaotic hallway had recognized what was happening inside his body before his vital signs had fully confirmed it. Barely 5 minutes later, a man in his 60s named Walter Briggs went into cardiac arrest in Bay 7, the monitor screaming its flat warning tone across the department. Compression started within seconds, A rotation of hands taking turns the moment arms began to tire, Marcus counting the rhythm out loud to keep the team in sync. Avery arrived at the bedside between compressions, checking the rhythm on the monitor with a glance, calling for the defibrillator before anyone else had finished reaching for it. "Charge to 200, she said. "Clear." The shock ran through Walter's chest, his body jolting once against the gurney, and for 3 agonizing seconds the monitor showed nothing at all. Then the line moved, faint and irregular at first, then steadier, climbing back into something that resembled a working rhythm. "We've got a pulse," Pierce called out, relief cracking through the exhaustion in his voice. Avery didn't pause to celebrate it. She was already moving toward the next bay, the next set of vitals, the next decision waiting to be made, the small victory folded away to be felt later. The way she had told Dana, she folded everything else away, until the night finally gave her permission to feel it. The night went on like that for nearly 3 hours. Patients came in waves, the department straining at every seam, voices raised and orders shouted, and machines beeping in a chorus that never fully stopped. Avery stayed at the center of it the entire time, calm in a way that had stopped feeling strange to the people around her, and started feeling, instead, like something to lean on. Marcus, running supplies from one bay to the next, found himself orienting toward her without meaning to, the way a compass needle settles toward north, without the compass doing anything to make it happen. Whenever he wasn't sure where to take something, he looked for Avery first, because Avery always knew. Pierce, exhausted, soaked through with sweat under his scrubs, caught himself at one point simply watching her work a particularly difficult IV line on a frightened older woman, talking the patient through it, in that same low, even voice she used for everyone, the voice that made chaos sound, for just a moment, survivable. Closer to the 2-hour mark, a teenage girl named Sophie Marsh was wheeled in with a deep laceration along her forearm, sustained when a window had shattered during the crash, and she would not stop apologizing to everyone who touched her, as if her injury were somehow an inconvenience she had chosen to inflict on the room. Avery sat with her while a resident closed the wound, holding her uninjured hand and keeping her talking about anything except the needle. "You don't have to apologize," Avery told her, somewhere around the 15th. "Sorry. You're allowed to be hurt. That's the whole reason we're here." Sophie's eyes filled, not from the pain but from something closer to relief, the particular relief of a frightened person being given permission to simply be frightened without performing bravery for an audience. She made it through the closure without flinching again, her hand gripping Avery's the entire time, and thanked her twice on the way out, this time without apologizing for needing to. "She's not normal," Pierce said to Dana, during the only 30 seconds either of them had to breathe that whole night. "No," Dana agreed, "she's not." By the time the last patient was stabilized and moved, somewhere past midnight, the department looked like the aftermath of a storm. Gauze wrappers littered the floor. IV poles stood at odd angles where they'd been abandoned mid-use. The whiteboard at the nurses' station was covered edge to edge in names and room numbers, and notes scrawled too fast to be entirely legible. The staff gathered in small, exhausted clusters, the particular silence of people who have just spent hours running on something other than normal energy, the silence that comes after adrenaline finally lets go of a body. Someone found a box of donuts that had been sitting forgotten in the break room and passed it around without ceremony. Nobody had the energy left for ceremony. Marcus sat on an upturned crate of his own a few feet away, hands still faintly trembling from the hours of motion, and found himself laughing quietly at nothing in particular, the specific punch-drunk laughter that follows a night too intense to process all at once. Nobody asked him what was funny. Nobody needed to. They had all felt some version of the same thing settle into their chests as the adrenaline finally let go. Avery sat on an overturned supply crate near the nurses' station, sleeves pushed up, the scar on her forearm visible for once, and unnoticed by anyone too tired to look closely. Dana walked over and sat down beside her without asking permission, which was, in its own way, the closest thing to an apology Dana had ever offered anyone. 23 patients, Dana said. "We didn't lose a single one." "We got lucky," Avery said. "That wasn't luck. I've worked nights like this before. People die on nights like this, even when everyone in the room is good at their job. Tonight, nobody died." Avery didn't answer right away. She looked down at the scar on her arm, then pulled her sleeve back down, an old habit reasserting itself, even though there was no longer much point in hiding it from this particular person. I've seen worse nights, she said quietly. Lost people on worse nights. You learn things when that happens enough times that you don't ever forget. Dana wanted to ask what kind of nights. She wanted to ask where, and when, and how someone learned to read a bleeding spleen from 6 feet away in under 2 seconds. But something about the tired honesty in Avery's voice told her the question would have to wait for another time. That pushing now would close a door that had only just barely opened. You ran triage like you'd done it 100 times, Dana said instead, choosing the safer edge of the question. Not nervous once, not even when Ethan Cole's pressure was dropping in front of us. Nervous doesn't help the patient, Avery said. I learned that the hard way, a long time ago. Doesn't mean I don't feel it. Just means I learned where to put it so it doesn't slow my hands down. Where do you put it? Avery considered the question longer than she'd considered anything else that night. Later, she said finally. I put it later. Tonight, later hasn't arrived yet. Dana let that sit, sensing it was as close to an honest answer as she was going to get, and nodded slowly, filing it away with everything else she had collected about the quiet nurse over the past several weeks. So instead she said, "Thank you." For tonight. Avery looked at her, surprised by the simplicity of it, and something in her shoulders loosened slightly, the smallest fraction of tension releasing after 2 weeks of being braced for something she had expected the whole department to throw at her. "You're welcome," she said. They sat together for a few more minutes in the wreckage of the night, not speaking, simply breathing, the kind of silence that two people share only after surviving something together. Around them, the department slowly put itself back into order. Gurneys wheeled back to their corners, supplies restocked, the whiteboard wiped clean for whatever the next shift would bring. Nobody in that exhausted donut crumb-covered room had any idea that the real test of who Avery Hale truly was had not yet arrived. It was still 3 weeks away, waiting on a stretch of mountain road none of them had heard of yet, attached to a name that was about to be called out over a hospital radio in a voice none of them would ever forget. For tonight, it was enough that everyone had lived. Tomorrow, the questions would start again. But for the first time since she had walked through the doors of Riverside General, Avery Hale went home that night without bothering to hide the scar on her arm at all. 3 weeks passed, and Riverside General settled into a rhythm that felt, for the first time since Avery's arrival, almost ordinary. The whispers about her had changed shape entirely. Where once people had joked about her silence, now they spoke of her with a kind of careful respect. The respect people give someone they don't fully understand, but have learned not to underestimate. Dana had started asking her opinion on difficult cases before making final calls. Pierce had stopped double-checking her work, something he did with almost no one else on staff. Marcus had simply started calling her boss, half joking, in a tone that wasn't entirely a joke at all. Still, the deeper questions remained unanswered. Where had she trained? What kind of busier place had she worked at before? Why did her hands sometimes pause for half a second at sounds that meant nothing to anyone else? A dropped tray, a door slamming too hard, the particular whine of a machine warming up. Avery never offered the answers, and the department, bruised into a strange new patience by the bus crash, had mostly stopped asking. During those 3 quiet weeks, the kind of trust that cannot be rushed had started building itself in small, deliberate increments. Pierce brought her into a difficult case involving a patient with confusing, contradictory symptoms, not because protocol required it, but because he had started trusting her instincts over his own training in moments where the two disagreed. The patient turned out to have a rare blood clotting disorder that Avery recognized from a pattern she had seen exactly once before, years earlier, in conditions far different from the clean hallways of Riverside General. "How did you even think to test for that?" Pierce asked afterward, genuinely curious rather than territorial about it. "I saw it once," Avery said. "Different patient, different country. You don't forget the ones you almost lose." It was a small admission, barely a sentence, but Pierce noticed it the way Dana had noticed similar admissions before him, filing it carefully alongside everything else nobody had quite pieced together yet. Even Priya, the young nurse who had once shouted back at an angry family member while Avery calmly diffused the same situation weeks earlier, had started seeking her out before difficult shifts, asking quiet questions about how to stay steady when a room turned chaotic. Avery answered every question patiently, never once mentioning the early weeks of sticky notes and whispered nicknames, as if she had already decided that part of the story no longer mattered enough to bring up. One evening during that stretch, a frequent visitor to the department, An elderly man named Harold Pace, who came in every few weeks with complications from a chronic heart condition, asked specifically for Avery by name when he was wheeled into triage. He had noticed, over several visits, that she remembered small details about his life that the rotating cast of residents never bothered to ask about: the names of his grandchildren, the fact that he still mowed his own lawn despite his doctor's objections, the small, stubborn pride he took in still being useful to somebody. "You're the only one who talks to me like I'm still a person and not just a chart," Harold told her, gripping her hand with surprising strength for a man whose heart was failing him by degrees. "You are still a person," Avery said. "That doesn't stop being true just because you're sick." It was a small exchange, easily missed in the noise of a busy evening, but it was exactly the kind of moment that had quietly built her reputation among the patients who returned again and again, the ones who remembered, long after they'd forgotten the names of the doctors who treated them, the nurse, who had simply bothered to see them. It was a Friday evening, the sky outside already darkening early the way it does in late autumn, when the call came in that would finally answer every question at once. The radio at the nurses' station crackled, but this transmission sounded different from the start. The voice on the other end clipped and tense in a way that had nothing to do with a routine transport. "Riverside Trauma. This is Lifeline 3 inbound. ETA 8 minutes. Single critical. Male. Mid-20s. Multiple gunshot wounds sustained during an attempted robbery. Unstable vitals. Field intervention in progress. Requesting Trauma Bay 1 be cleared and fully staffed on arrival." Dana grabbed the radio, already calling for Bennett to be paged, already directing Marcus to clear the bay. It was routine, the kind of grim routine the department had handled a dozen times before. Then the voice on the radio continued, and the routine cracked wide open. "Additional request," the pilot said. "Is Specialist Hale on shift tonight? Repeat. Is Specialist Hale on shift? Patient requires field trauma protocol. Requesting Hale by name if available." The department went still, in a way it hadn't even gone still during the bus crash. Dana stood frozen with the radio in her hand, staring at it as if the words might rearrange themselves into something that made more sense. "Specialist who?" she said, mostly to herself. Across the room, Avery had already set down the chart she'd been holding. Her face had changed in a way none of them had ever seen before, the calm still there, but something else layered underneath it now. Sharper, older, the look of a person stepping back into a version of themselves they hadn't worn in a long time. "That's me," she said. Nobody had time to ask the question hanging in the air, because the radio crackled again, the pilot's voice tight with urgency. "Copy that. Lifeline 3 is inbound. 6 minutes. Patient is critical." Avery moved toward Trauma Bay 1 without waiting for instructions, and something about the way she moved had changed entirely. Gone was the careful, contained pace she had walked the halls with for over a month. In its place was something faster, sharper, a kind of fluid certainty that made the rest of the staff instinctively clear a path for her without being asked. "Bennett's 2 minutes out," Pierce called, jogging to keep pace beside her. "What do you need?" "Oh, -6 units. Ready before he hits the door," Avery said, already pulling open the trauma cart and checking its contents, with hands that moved faster than anyone had seen them move before. 2 large bore lines open. Chest tube tray set up and ready. Get me a rapid infuser. Pierce didn't ask how she knew exactly what would be needed before the patient had even arrived. He simply relayed the orders, because something in her voice had made arguing feel not just unnecessary but actively dangerous to the man currently bleeding somewhere in the sky above them. Dana, setting up alongside her, found her voice again. "Who calls a nurse by name from a helicopter?" "People who've worked with me before," Avery said, not looking up from the tray she was organizing with brutal efficiency. "Pilots remember names, especially when the name belonged to someone who kept people alive when nobody else could." It was the most she had ever said about her past in a single sentence, and there was no time to ask for more, because the radio crackled one final time with the words that meant the helicopter was on final approach, and the entire trauma bay seemed to inhale at once and hold its breath. In the minute before the elevator doors opened, the room fell into a strange, charged stillness, the particular quiet of people who know exactly what is coming and have nothing left to do but wait for it to arrive. Marcus stood near the trauma cart, double-checking equipment he had already checked twice. Dana found herself watching Avery instead of the doors, unable to look away from the transformation that had taken hold of her. The easy, unhurried nurse from the past month, replaced by someone leaner and faster, someone whose hands moved like they belonged to a different person entirely, or perhaps to the same person finally allowed to be fully herself again. "You ready?" Pierce asked her quietly, more out of habit than real doubt. Avery didn't answer right away. She rolled her shoulders once, the way a runner settles into the blocks before a race, and the calm that came over her face in that moment had nothing soft about it at all. "Always," she said. The helicopter set down on the roof pad 4 minutes later, the heavy beat of its rotors thudding through the building even 3 floors down. The elevator carrying the patient and his flight crew arrived in the department in under 90 seconds, and the doors opened on a scene that made even the most hardened staff member in the room go quiet. The patient, a young man who couldn't have been older than 25, lay strapped to the gurney with 2 separate wound sites, visibly bleeding through field dressings, his skin the pale gray color that meant his body was running out of blood faster than it could be replaced. The flight medic riding alongside him, a broad-shouldered man with a headset still slung around his neck, looked up as the gurney rolled into the bay, and his eyes found Avery immediately. "Hale," he said, relief breaking across his face like sunrise. "Knew this was your district when dispatch said Riverside. Good to have you back." "Talk to me, Connor," Avery said, already moving alongside the gurney, hands working even as she spoke, cutting away the field dressing on the patient's chest with quick, precise motions. "What've we got?" 2 GTSWs, right chest and left flank, the flight medic, Connor Briggs, said, falling into step beside her, like they had done this exact motion 100 times together. "Lost radial pulse 4 minutes out. Decompressed the chest in flight, but I think we're looking at a second bleed I couldn't reach. Flank entry, no exit," Avery said, eyes scanning the wound with the same speed she had used to triage the bus crash victims weeks earlier. Except now there was nothing careful or contained about it at all. This was something else, something that looked less like nursing and more like a kind of combat she had clearly survived many times before. Pressures in his boots, he's bleeding into his belly. The monitor's rhythm faltered, a brief stutter that made every person in the bay go rigid for a fraction of a second. Avery didn't flinch. She tilted the gurney to bring more blood toward his core, called for a second rapid infuser, and pressed 2 fingers against the pulse point at his neck, without ever taking her eyes off the wound. "Pulse is thready but there," she said. "He's not gone. He's just running on fumes. Where is Bennett?" 30 seconds out, Pierce said, phone still pressed to his ear. "He doesn't have 30 seconds to spare. He has 30 seconds, period," Avery said, and the distinction in her voice, the certainty under the urgency, was enough to make the entire team move faster, without a single one of them needing to be told twice. Bennett arrived at that exact moment, scrubs already tied, and didn't waste a single second on questions. "OR's ready. What's the call?" "Now," Avery said. "He doesn't have 20 minutes." The team moved as one unit, the rapid infuser already pushing blood into both lines, the gurney already turning toward the elevator that would take the patient straight up to surgery. Avery walked alongside it the entire way, one hand pressed firm against the dressing on his side, her voice low and steady in his ear, even though he was unconscious and couldn't hear a word of it. The same voice she had once used to talk frightened patients through procedures. Except now, there was something underneath the calm that sounded almost like a memory, a habit worn smooth by repetition in places far from this hospital. "Stay with me," she murmured. "You're not done yet. Stay with me." The elevator doors closed on the gurney and the surgical team, and the trauma bay went quiet, in the specific way a room goes quiet after a storm has just passed through it, and left everyone standing, breathless, trying to remember how to talk normally again. Connor Briggs stood near the now empty gurney bay, peeling off his gloves, and looked at Dana, who was still holding the radio in one hand like she'd forgotten it was there. "How do you know her?" Dana asked. Connor smiled, tired and a little sad around the edges. Hale ran trauma medicine overseas for 6 years. Combat zone work, the kind most people can't picture and wouldn't want to if they could. She kept more people breathing in worse conditions than most surgeons see in a whole career. When she came home, half the flight crews in this region knew her by name. Figured she'd gone quiet somewhere. Didn't expect quiet to mean working the floor at a regular ER. "Why would someone like that leave?" Dana asked. "Why come here, of all places?" Connor shrugged, the gesture of someone who had wondered the same thing himself more than once. "People burn out different ways. he said. Some people leave because they stop caring. Hale's not like that. I think she left because she cared too much, for too long, and needed somewhere quieter to set it down for a while. This job, the regular kind, lets you save people without losing anyone every other week. I imagine that matters, after enough years of the other kind. Dana looked toward the elevator, toward the place Avery had disappeared with the patient, and thought of every small strange moment over the past month, the scar she kept hidden, the way she counted seconds out loud during the seizure, the rigid stillness that had crossed her face the one time Pierce grabbed her wrist without warning, the calm, terrible efficiency she had shown during the bus crash, sorting bodies into categories with the kind of speed that only comes from doing it far too many times before. It all made a different kind of sense now. Not an explanation, exactly, because nobody in that room would ever fully understand what 6 years in a combat trauma unit actually cost a person. But a shape, at least. A reason for the silence that had nothing to do with arrogance or coldness, and everything to do with carrying something too heavy to set down in casual conversation. She never said a word, Dana said quietly. She wouldn't, Connor said. People like Hale don't talk about it unless the job in front of them needs it. The rest of the time, they just do the work. 3 floors up, in an operating room bright with overhead lights, Grace Bennett's hands moved fast and sure inside a young man's abdomen, working to close a bleed that would have killed him within the hour if it had gone unnoticed even a few minutes longer. The surgical team worked in focused silence, the kind of silence that means everyone trusts everyone else to do their job without narration. Down in the trauma bay, the waiting stretched long and strange, the way waiting always does after a crisis has burned through a room and left nothing behind but the slow work of putting furniture back where it belongs. Marcus restocked the cart Avery had emptied with such precision, counting supplies twice out of nervous habit rather than necessity. Pierce sat at the station charting other patients' notes without really seeing the words, his eyes drifting every few minutes toward the elevator banks. Dana found Connor Briggs still lingering near the empty bay, reluctant to leave before he knew the outcome, the way flight crews sometimes stayed long after their official job had ended. "Does this happen a lot?" Dana asked him. Crews asking for her by name. "More than you'd think, for someone who's only been back stateside a couple of years," Connor said. "Word travels fast in this work. You save the right person on the wrong night, in the wrong place, and people remember your name for the rest of their careers." What night was that for her? Connor's expression shifted, something careful closing over it. "Not mine to tell," he said. "That one's hers, if she ever decides to give it to you." Dana accepted that without pushing, filing the boundary away the same careful way she had filed everything else. And the two of them simply waited together, the minutes stretching past 1 hour and then deep into a second, the department's ordinary evening sounds carrying on around them, as if nothing extraordinary had happened at all, even though everyone present knew exactly how extraordinary it had been. It would be nearly 2 hours before word came down that the patient had survived the surgery, his vitals stabilizing, his prognosis, for the first time since the helicopter lifted off from the scene of his shooting, finally good. Down in the trauma bay, the department slowly came back to life, the ordinary hum of the evening reasserting itself over the lingering echo of the storm that had just passed through. Dana set the radio down at last, looked around at the staff still standing in stunned little clusters, and said the only thing that felt true enough to say out loud. "I think we've been working with someone extraordinary, and none of us had any idea." Nobody disagreed. The days after the helicopter call moved differently through Riverside General, the way a building feels different after everyone living in it has survived the same storm together. Avery didn't change. She still arrived early, still checked the crash cart drawers without being asked, still spoke in that same low, even voice that had once been mocked, and was now simply understood as part of who she was. What changed was everyone around her. Dana stopped by her station one morning with 2 coffees instead of 1, set the second cup down without comment, and walked away before Avery could thank her. It wasn't an apology. Dana wasn't built for those. But the coffee said enough, and Avery understood exactly what it meant. Marcus had taken to walking beside her during quiet stretches of the shift, asking small questions about field medicine, about how trauma protocols differed in places without a hospital for 100 miles in any direction. Avery answered some of them, simply and without drama, the way someone describes a job they've made peace with, rather than a wound they're still bleeding from. "You ever get used to it?" he asked her one slow Tuesday afternoon, restocking gauze beside her in the closet that had once been hers alone to deal with. The bad nights, I mean. Out there. Avery considered the question for a moment, hands still moving, sorting supplies into their proper bins. You don't get used to it, she said. You get steady. There's a difference. Used to it means it stops hurting. Steady means it still hurts, but your hands don't shake anymore while it's happening. Marcus didn't have a response for that, and Avery didn't seem to need one. They finished restocking the shelf together in comfortable silence for a while before Marcus spoke again, quieter this time. Do you miss it? He asked. Out there. Avery set the last box of gauze on its shelf and considered the question with the same care she gave every question that actually mattered. I miss the certainty of it, she said. Out there, you always knew exactly why you were needed. In here, it's quieter. Took me a while to learn that quiet work still matters just as much. Maybe more, some days, because nobody's shooting at the people you're trying to save. Marcus laughed softly at that, surprised by the small dry humor folded into something so heavy, and Avery allowed herself the faintest answering smile, the kind she rarely let anyone see. You're different than I thought you'd be, he admitted, when you first started. I thought quiet meant cold. Quiet usually just means paying attention, Avery said. Loud people miss things. I learned that the hard way too. That was, in its own quiet way, the closest thing to a real conversation about her past that the department would get for a long while yet. Word had spread, of course, the way it always does in a hospital, fact and rumor tangled together until nobody quite remembered which parts had come from Connor Briggs and which parts had simply grown in the retelling. 6 years in a combat trauma unit became, in some versions, 8. A handful of confirmed lives saved became, in the more excitable corners of the rumor mill, numbers nobody could actually verify. Avery let the stories grow without correcting them, because correcting them would have meant talking about it, and talking about it had never been the point. The hospital administration, never one to let a good story go unrecognized, put together a small ceremony the following week to honor the staff who had handled the bus crash and the shooting victim within the same difficult month. It was a modest affair, held in the staff lounge, a sheet cake and a few framed certificates, and a short speech from the hospital director that nobody really listened to. Avery stood near the back of the room throughout the entire thing, uncomfortable in a way that had nothing to do with the people around her, and everything to do with being looked at directly, on purpose, by a room full of people clapping. When her name was called for the certificate, she walked up, accepted it with a small nod, and returned to the back of the room as quickly as the moment allowed. Dana noticed, watching from across the lounge, and found herself thinking that some people simply weren't built for praise, the same way some people weren't built for cruelty, and that the two facts probably had more to do with each other than anyone in that room would ever fully understand. After the cake had been mostly eaten and the certificates folded into pockets and bags, Dana caught Avery near the door, slipping out before the small crowd could pull her into more conversation than she wanted. You didn't have to stay for that, Dana said. I know, Avery said, felt rude not to. You could have just told me you don't like ceremonies. I'd have covered for you. Avery considered that, something almost warm passing behind her eyes. Next time, she said, I'll remember that. The one person who got more than rumors was Dana, and only because she finally asked the right question on the right night. It happened nearly 2 weeks after the helicopter incident, during a slow overnight shift when the department had emptied out enough for both women to sit together at the nurses' station without interruption. Dana had brought up the scar without meaning to, glancing at Avery's forearm as she reached for a chart, the old habit of looking away replaced now by simple, unbothered familiarity. Can I ask about that? Dana said. Or is it one of those things you don't talk about? Avery looked down at her arm, then back up at Dana, weighing the question the way she weighed every question that touched the parts of her life she kept folded away. Shrapnel, she said. Field hospital, 4 years ago. A patient I was treating didn't make it. I almost didn't either. She didn't offer more, and Dana, for once, didn't ask for it. The single sentence sat between them, complete in its own way, heavier for everything it left unsaid. Some nights, Avery had learned, deserved exactly one sentence and no more, because explaining the rest would mean reliving it, and reliving it served no one, least of all the patients waiting for her hands to be steady the following morning. Thank you for telling me that much, Dana said. Thank you for not asking for more, Avery answered. and something passed between them in that exchange that felt, for the first time, like the beginning of something closer to friendship than coexistence. 3 weeks after the shooting victim had been airlifted into Riverside General, he was discharged from the hospital under his own power, walking out through the front doors on legs that had nearly stopped working entirely that Friday night. His name was Caleb Reyes, and before he left, he asked to see the nurse who had been waiting for him in the trauma bay, the one Connor Briggs had called out for by name from somewhere above the clouds. Avery met him near the discharge desk, and Caleb, thinner than he'd been on arrival but steady on his feet, didn't know quite what to say to the woman who had kept him alive long enough for a surgeon to finish the job. "They told me you used to do this overseas," he said, "in worse places than this." "Something like that," Avery said. "Guess I got lucky they had someone like you on shift that night." Avery thought about correcting him, about explaining that luck had very little to do with it, that what had actually saved him was a particular kind of training, built over years in rooms with far less light and far fewer resources than the one he'd been treated in. But she only smiled, the small, careful smile she gave to patients who didn't need the full weight of the truth, only the comfort of it. "What will you do now?" Avery asked him instead, steering the conversation somewhere more useful than gratitude. Caleb thought about it, surprised to be asked. "Get a different job, probably," he said, "one that doesn't put me anywhere near a robbery in progress. Spend more time with my little sister. I keep thinking about how close I came to not getting the chance to do either of those things." "That sounds like a good use of a second chance," Avery said. "Take care of yourself, Caleb," she said. He nodded, shook her hand with a grip that was nearly back to full strength, and walked out through the sliding doors into a future that existed only because of the 6 minutes between a helicopter radio call and a surgical team standing ready. That evening, after her shift ended, Avery sat in her car the way she always did before driving home, hands resting on the wheel, eyes closed. This time, instead of reaching for the radio to change the station, she let the news report play through to the end, the unfamiliar place name pronounced wrong one more time. She didn't flinch from it the way she once might have. She simply listened, let it sit in the quiet of the car for a moment, and then pulled out her phone and typed a short message to someone whose name never appeared anywhere in her hospital file. Someone from a unit that no longer existed in the way it once had. "Thinking of you today," the message said. "Hope you're keeping steady." The reply came back within a minute. 3 words and nothing more. "Always do, Hale." She set the phone down, started the engine, and drove home with the radio off entirely, the silence itself feeling, for the first time in a long while, like something closer to peace than absence. Life at Riverside General settled, after that, into something that finally resembled normal, though normal now carried a different shape than it had before Avery Hale walked through the doors. The mockery was long gone, replaced by something closer to trust, the kind of trust that gets earned in increments too small to notice, until suddenly it's the whole foundation a department stands on. It was on a gray Monday morning, almost 2 months after Avery's first day, that a new hire arrived at the department for her very first shift. Her name was Maya Donnelly, 24 years old, fresh out of nursing school, visibly nervous in the way every new nurse is nervous, hands a little too tight around her clipboard, eyes scanning the department like she was trying to memorize an exit route in case she needed one. Priya, passing by with a stack of charts, paused long enough to give the new girl a quick, genuine smile, an instinct she wouldn't have had 2 months earlier. "First day's the hardest," she said. "It gets better. I promise." It was a small kindness, the kind Priya herself hadn't received during her own first weeks on the floor, and she walked on without waiting for a thank you, already certain the new girl would understand soon enough that something had changed in this department since the days when calm got mistaken for weakness. Dana, at the station, glanced up and gestured toward the supply closet without much thought. "New girl, go restock Bay 6 and try to stay out of the way." It was the exact same sentence she had once said to Avery, almost word for word, and for a moment, something in Avery's chest tightened at the echo of it. She watched Maya nod and head toward the closet with the same careful, eager nervousness Avery herself had once carried through these same hallways. Avery finished the chart she was working on, then crossed the department and stepped into the closet behind Maya, who jumped slightly at the sound of someone else entering the small space. "Sorry," Maya said quickly. "I'll get out of your way." "You're not in my way," Avery said. "I just wanted to show you where everything actually is. The labeling in here is a mess. Took me a while to figure it out myself. Maya blinked, surprised by the kindness of it, the simple offer of help that nobody else in the department had bothered to extend during her first nervous hour on the floor. Avery walked her through the shelves, pointing out which supplies ran low fastest, which drawer stuck if you didn't lift it at the right angle. Small, practical knowledge passed from one set of careful hands to another. "Everyone keeps looking at me like I'm going to mess something up," Maya admitted quietly, restocking gauze beside her. Avery thought of sticky notes on lockers, of jokes about silence, of 2 solid weeks spent proving herself one careful action at a time, without ever once raising her voice to defend it. "You won't," Avery said. "Just do the work. Let the work speak for you. It always does, eventually." Maya looked at her for a long moment, something steadying in her expression, the particular relief of a nervous person finding one person in a new place who seems to actually see them. "Were you ever the new girl here?" Maya asked. Avery almost smiled. "Once," she said, "not so long ago." They finished restocking the closet together, and when they stepped back out into the department, the morning had already begun its familiar churn, monitors beeping, phones ringing, the low constant hum of a hospital doing what hospitals always do. The test came less than an hour later, the way it always seems to come on a first shift, as if the hospital itself had decided the new girl needed proving out before lunch. A man in his 40s was wheeled in, struggling for breath, his face a color that made everyone within sight of him move a little faster. Maya froze for half a second at the sight of him, her hands tightening on the chart she was holding, the particular paralysis of someone who has studied 100 textbook cases and never once stood 3 feet from a real one. Avery appeared at her side before the freeze could turn into anything worse. "Breathe with me," she said quietly. Just to Maya, not to the room. "In through your nose. Hold it. Out slow. Now hand me that oxygen mask, and follow what I do." Maya did exactly that, and her hands, though still trembling slightly, found their way through the motions Avery walked her through one careful step at a time, fitting the mask, checking the flow rate, watching the numbers climb on the monitor as the patient's color slowly returned to something closer to normal. "You did that," Avery told her afterward, once the patient was stable and the chaos had drained back out of the room. "I just stood next to you while you did it." "It didn't feel like that," Maya said, hands still a little unsteady. "It never does, the first time," Avery said, "or the 50th, honestly. You just get better at making it look like it does." Maya laughed, surprised and relieved, and something in her settled the way it had settled once before, in a supply closet that smelled faintly of antiseptic and old cardboard. Avery walked back to her station, calm as ever, unremarkable to anyone who hadn't been paying close enough attention. But the staff around her had learned to pay attention now. They knew, in a way they hadn't 2 months earlier, that the quietest person in the room was very often the one worth watching most closely, the one whose stillness wasn't emptiness at all, but the kind of steadiness built from carrying more weight than most people would ever be asked to carry. Dana watched Avery walk Maya through her first morning with a faint, satisfied nod, the closest thing to a smile she allowed herself during a shift. Somewhere above the hospital, another helicopter passed on its way to another emergency, entirely unrelated to Riverside General, its rotors a distant hum against the gray morning sky. Avery didn't look up at the sound the way she once might have. She simply kept working, steady hands moving through another ordinary day, carrying everything she had learned in places far from this hospital, quietly forward into the next patient who would need her, and the one after that, for as long as the work required her to stay ready. There would be other hard nights ahead, other helicopters, other names called out over a radio in voices tight with urgency. There would be other new hires who needed someone to walk them through a mess of a supply closet, and other mockers who would learn, eventually, the same lesson the department had learned about her, that quiet was never the same thing as weak, and that the steadiest hands in any room are often the ones that have already survived the worst it has to offer. That, in the end, was who she had always been, not the quiet new nurse they had mocked on her first morning, Specialist Hale, who had simply been waiting, the whole time, for the moment her steadiness would matter most.